The search for unmarked graves goes beyond former residential schools, but also so-called Indian hospitals, like the Charles Capsule site here in Edmonton, largely racially segregated sites to treat tuberculosis, separating the ill from their families with reports of forced sterilization.
Nunavut and other parts of the country were, transported thousands of miles away to receive treatment where sometimes they were admitted to hospital for years.
On this first National Day for Truth and Reconciliation, the president-elect of the Canadian Medical Association reflects on past, but also present pandemic-related health inequities for Indigenous Canadians.
There were decisions made historically where we just chose not to create health infrastructure in a place where Indigenous peoples could easily and readily access it.
Working as an anesthesiologist in Grand Prairie, Dr. Alika Lafontaine notes that Indigenous communities often have a different standard of care, pointing to how remote work camps will often be required by government health and safety to have a 24/7 doctor or nurse and a plan for evacuation. But a First Nations community next door would need to travel, sometimes for hours, for basic care for things like diabetes and pregnancy, as well as emergencies.
And these are really choices that we make. And I think the pandemic's really taught us that the choices we make have both short and long-term consequences. And the effect of how fast and, how much capacity is being demanded because of the surge in acute care has kind of accelerated these lessons in a way that we're learning them in real time.
As the first Indigenous doctor elected to lead the CMA, Lafontaine is hopeful that room is being made to talk about the health inequity and racism within the system. And often, solutions are already in front of us to make the system better for everyone.
About creating relationships. Sometimes in Indigenous communities, we talk about protocols. It's how do we bond people together? There's that common saying that the truth sets us free. But I think when you're talking about truth and reconciliation, the truth actually binds us together. So it's not about just being free. It's about developing relationships with each other and seeing the world the way that it really is so we can solve the problems that we have.
For our full interview with Dr. Lafontaine, you can find it on our City News YouTube page. From Edmonton, Carly Robinson, City News.